this information. All right, so again, tonight we are going to be talking about what to do during the coronavirus pandemic if you or your loved one is hospitalized. All right, so let me just quickly reintroduce myself to those of you who may have just tuned in. So I am Dr. Nicole Rochester. I'm a board certified pediatrician, an independent health advocate, and the CEO of Your GPS Doc. You are watching Navigator Nuggets, which is my weekly Facebook Live show every Monday night at 8 p.m. here on my Facebook page. You can catch all of the previous episodes on my YouTube channel. I will drop the link to that, but it's bit.ly/GPS, YouTube GPS doc, bit.ly/YouTube GPS doc. So I encourage you to go to my YouTube channel, subscribe to the channel. That's a much easier place if you want to go back and catch some of the previous episodes, okay? All righty, so let's see here. All right, so let's go ahead and get started. So like I said, there have been some common themes that are coming up among people who are being hospitalized during this pandemic. And let me be clear, whether or not you are in the hospital because of coronavirus or whether you're in the hospital for something else. I've had a family member be hospitalized for something totally unrelated. I've had a good friend be hospitalized during this pandemic for something totally unrelated. And guess what? They face the exact same challenges that individuals who have been hospitalized with coronavirus have faced. And the reason for that is because we don't, there's a no visitor policy, right? So as a result of that, it is making it very, very difficult for individuals to really effectively advocate for themselves, particularly if they're sick. And you all know I am all about advocacy. I always talk to you to make sure that, your family members are well-versed, that they can help advocate for you so that you can help advocate for your loved ones. And I've shared with you all so many stories about how my ability and my sister's ability to effectively advocate for our dad made a huge, huge difference. We caught mistakes and errors, and many times we had to be the ones to fill in the gaps and provide information that he would leave out. And so now during this pandemic, when there are no family members allowed at the bedside, really from the point of entry, I mean, they are stopping you in that ER triage if they even let you inside the hospital room at all. I've talked to a lot of people, and this was the case with my own family member, where they allow one person, initially in that front door of the ER to help provide any information. And then that's it. You're waiting in your car. And if they get hospitalized or admitted, you are basically going home. And you are then relying on the patient that's in the hospital to hopefully be able to fend for themselves, or you're relying on, phone calls and things of that nature. So now more than ever, we all have to be prepared to advocate for ourselves if, God forbid, we are sick enough or our loved ones are sick enough to be hospitalized, because you will not have that daughter, that son, that mom, that caregiver at your bedside watching over the team to make sure that they're doing the right thing, giving them the information that they need, correcting, errors in judgment and things like that, or mistakes on the chart. You aren't going to be there. And these are dangerous times. And I'm not saying this just to scare you, but because I've seen all of the errors and the mistakes and all of the drama that goes on, particularly in hospital settings, I am very, very concerned about the care that individuals are receiving. And I'm not saying that, the nurses and the doctors are amazing, right? But we just know under the best of circumstances, mistakes are making. That is just the nature of our healthcare system. And now resources are stretched tight. People are stressed. Many of the healthcare providers themselves are sick. So that leaves these units short-staffed. And so there are just a whole lot of things that are happening that unfortunately make it more likely that errors and things of that nature may occur. So I want to make sure that you all are equipped with the information that you need, so that if you or a loved one is hospitalized during this time, that you have the best chances of getting the medical care that you need, okay? All right, so the first thing I want to talk about is the fact that, like I said, they are not allowing visitors. And so what does that mean? What that means is that you, if you're the one in the hospital or your family member, it is all going to fall on them. So now more than ever, you all have to be well versed about your medical history. Okay. And we talked about this a little bit last week when we talked about health disparities. If you missed that episode, I encourage you to go back and watch it. It has gotten a lot of traction. I've done some podcast interviews as a result of that. And I'm really excited about the way that that information was received. So go back and watch that one if you missed it. But we talked a little bit about the importance of, knowing your own medical history. And that this is important now more than ever, because you may present to a hospital that doesn't have access to your medical records. We talked in previous episodes of Navigator Nuggets that the electronic medical record that your primary care doctor uses or your specialist uses may not be the one that that hospital uses. And so they are going to be relying on you to provide that information. And if you are in the hospital or in the ER, by definition, you're not at your best, right? So it's going to be even more difficult. So you want to just become intimately familiar. Make sure that you know your medical history, okay? Make sure that you know the names of the conditions that you have, the surgeries that you had, the medications that you take, the dosage of those medications that you take, allergies to medications. It is really, really important, because if you forget some of that information, or if you don't have some of that information, there may be delays. They're always going to try to reach your primary care doctor. But again, a lot of the offices, the primary care offices, are closed as a result of the pandemic. Many offices, I've had a lot of friends and family members that have had difficult times reaching their doctor by phone. Many of the offices have kind of shut down, and they're doing most of their visits via telemedicine. So because of that, and because of the fact that the doctors in the hospital are incredibly swamped, they're not going to have time to make multiple phone calls to your doctor, trying to reach them, leaving messages, getting calls back. So again, it's going to be important that you have as much information about your medical history as possible. And we're going to talk a little bit more about how you can facilitate that, okay? The other thing is that, again, we've talked about the fact that your family members are not going to be able to visit. And so you're going to be in that hospital alone. And so now I'm speaking to the family members. You all are going to be up against some barriers. And one of the things that I have seen come up over and over again is a difficulty getting in touch with the people who are caring for the patient. So difficulty getting that nurse on the phone, difficulty getting that doctor on the phone. And this is going to continue, just based on all the challenges that I have already talked about. So a couple of things that may come up is that they may tell you that we can't give you any information about, your loved one because of HIPAA. Now, HIPAA is the Health Insurance Portability and something Act. Accountability? I'm forgetting what the other A is. But essentially, this is a healthcare law that protects your privacy. And it is a good law, okay? It's meant so that your information about your personal health is not being just widely shared willy-nilly, right? But unfortunately, it is misinterpreted so often, even by doctors and nurses and hospital administrators and other healthcare professionals. And unfortunately, when it is misinterpreted, it tends to serve as a barrier to care. We know that, if your spouse is in the hospital, or if your adult child, or, something like that, you are going to have useful information, and your ability to communicate with that doctor and not only give information, but receive information is critical. And so many family members are just feeling so anxious because they're having difficulty getting information about the status of their loved ones. So again, HIPAA may be brought up, and they may say, well, I can't talk to you because of HIPAA. Now, there are some ways around this, and I want to share some of that information with you all. First of all, again, this is something that you can be working on now. If you're healthy, thank God, go ahead and start putting some of these documents in place. Now, generally, whether you have, despite HIPAA, there are some rules that hospitals are going to follow that dictate who they can share your medical information with, okay? And generally, if you are married, your spouse is considered your next of kin. And so whether or not you have any documentation, and we're going to talk about that in just a minute, they are able to share information freely with your spouse, unless you are, conscious and in your right mind, and you have said, I don't want you to share that information with my husband or my wife. So generally, if you're married, your spouse is going to be your next of kin. But if you're not married and you have a fiance or you have a boyfriend or somebody you've lived with for 20 years, that person really doesn't have any legal rights when it comes to your health information unless you have designated that person. And again, we're going to talk about that in just a minute. If you are the parent of a minor child, then again, by definition, you are considered the next of kin. And so, with very few exceptions, they are going to share information with you. But if you are the parent like I am, I have a 20 and a 25-year-old child, they're considered adults. And so even though I'm a physician, I'm a health advocate, I am the best person, in my opinion, in their life to appropriately advocate for them, I may meet challenges if, God forbid, one of my kids gets hospitalized and I call up to the hospital and I'm trying to get information over the phone to help navigate, the system and to make sure that they're getting the proper care, because legally, I don't really have any rights as their mom because they are adults, okay? So ways to get around that is a healthcare power of attorney. So if you don't already have a healthcare power of attorney, this is a great time to begin developing one. Now, there are going to be some barriers because in many states, this requires a notary. In most states or all states, it requires witnesses. And of course, we're all supposed to be sheltering in place. So I'm going to be honest with you. I don't even know if notaries are functioning. I'm not sure how that works. I know that like the UPS store often has a notary on site. And I think the UPS stores are open during this time. So that may be a workaround. But let me just back up a minute. A healthcare power of attorney is a legal document in which you designate an agent or a proxy to make healthcare decisions on your behalf in the event that you are unable to do so. And that's really important, in the event you are unable to do so. So if you are conscious and you are in your right mind, then you're going to be making all of your medical decisions. And in that case, this is a good time for me to mention this. You can always tell the doctors and members of the medical team, yes, it's okay for you to share my information with this person. I want you to share my information with my sister, and this is her name, and this is her phone number. I want you to share information, my medical information, with my fiance, with my girlfriend, boyfriend. That is always okay. You can always give verbal permission to the medical team. But in the case, if you are severely incapacitated, if you are unconscious, if you are, on a ventilator and therefore sedated and unable to talk and, give that permission, then this healthcare power of attorney form is critical because it allows you to designate anybody. It can be your best friend from high school. It can be your next door neighbor. It can be somebody, in a whole nother state, whoever it is that you feel is best positioned to make medical decisions on your behalf. And I'm not going to get into a lot more details about that because we've talked about this in other episodes of Navigator Nuggets, but suffice it to say that you want to be very careful when you're choosing that person. You want to make sure that it's someone, who you feel is going to accurately represent your wishes. And of course, you should have conversations with that person ahead of time. So now is the time you can pull up these documents online. I mean, you can hire a lawyer to draft these things, but there are a lot of free forms online. And you in the comfort of your own home, you can pull these up and print them out and, go ahead and talk with the person who you think you'd like to designate and see if you can get those put in place even during this time of sheltering in place. Okay. Really, really, really important. So again, if you're a family member right now and you have someone hospitalized and you are having a difficult time, getting information, first of all, if they are incapacitated, on a ventilator, unconscious, and whether or not you have that document or not, if you are the next of kin, or if you feel that you are the right person, then you just need to be persistent and you just need to, basically let them know that you are the one making decisions. But, again, they don't want to be sued and they don't want to do the wrong thing. There are hefty fines associated with HIPAA. Usually the doctors and nurses and other members of the medical team are going to default to the person that they think is really, the next of kin, the person who has the most rights. So let me just go through that really quickly. If you don't have a healthcare power of attorney and you are unable to make these decisions for yourself, this is the order in which they will typically go in terms of medical decision making. Okay. So the first one would be a spouse. So again, if you are married, it's going to be your spouse. If you're not married, or if your spouse is deceased or you don't have a spouse, then it's going to be your adult children. Okay. So spouse, then comes adult children. After that comes your parents. So this may surprise, some of you, but adult children in this scenario actually have priority over parents. Okay. Then after parents come siblings. And then after siblings come grandchildren. And then after that come, close family friends. Now, if you are someone, or if your family member is someone who is disabled, cognitively disabled, and maybe there's a guardian appointed for that person, like, someone, a guardian of the state, not your estate, but a guardian, then that guardian has priority over all of those people. But those are very rare circumstances where a guardian has legally been appointed to act on behalf of an individual. Okay, so it's important that you all understand that hierarchy so that you're not calling up, cussing and fussing at the hospital. If you're a parent of an adult and that person has adult children and they have a spouse, then, don't get upset if the hospital is telling you that you don't have rights to that information. So hopefully you have a good relationship with those other people that I named that are higher in that hierarchy, and you can get your information from them. The other thing I want to tell you is that it is quite disruptive to have a whole lot of people calling up to the hospital asking for updates, especially now, you all. Please don't do that. The system is already stressed, and that's just going to make it worse, okay? And they're not going to repeat themselves over and over again. So if you have a family member hospitalized for any reason, designate one person, okay? So if that person's married, designate the spouse and then get all of your information from the spouse. Or if you want to be on the line, if you don't trust the spouse or you don't think they're medically savvy, or, you have whatever, then have the spouse call, but have that person have you conferenced in, and then you can be in the background listening or whatever. But the worst case scenario is to have one person call the unit and say, "Hi, I'm so-and-so. I want to get information about Mrs. Jones." Then an hour later, then some other family member calls. "Hi, I'm the cousin. Hi, I'm the aunt. Hi, I'm the dad." It really needs to be one person. And then the rest of you need to talk to that one person so that the information can filter down. Okay. That's another little tip. All right. So going back to the importance of knowing your medical history. We have talked in previous episodes about this, and in the comments, I think I put it in the comments for this episode, I created a guide. So many of you know I wrote a book for college students called Healthcare Navigation 101, a guide for college-bound students and their parents. And in that book, which is available on Amazon, shameless plug, there's a wonderful resource in that book I call the Healthcare Navigator Summary. And that is a document that parents and students can print out, or they can pull it up on their computer and fill it out. And it's a document that I encourage students to take with them when they go away to college, so that they have all of their health information at their fingertips. So I modified that document for you all in light of the coronavirus pandemic, because it is so important that you have your medical information at your fingertips, particularly if you present to the emergency room in extremis, meaning you are really, really sick, you're becoming critically ill, and you get to a point where you really can't effectively communicate. So you want to get this document, download it. It's totally free. You give your name, your email. You're going to get the document in your email. Print it out, fill it out. It's meant to be two-sided, but you can print it as, it's 2 pages. You can print it two-sided, which is what I recommend. But if you can't do that on your printer, just print out both pages. And this document has all of the information that your healthcare provider in that hospital setting is going to need. Your medications, your allergies, the name of your doctor, all this information. and you can literally hand it to them, okay? I would advise that you make a few copies, you know, put it in your wallet, keep it on your person, maybe keep one in your car, maybe put one on your refrigerator just in case, you know, the ambulance comes. The EMS staff are typically trained to look on your refrigerator for documents such as this. Also, they look for power of attorney, advance directives, living wills, all those kind of things. So I encourage you to get this free document. Again, download it, print it out, and fill it out so that if you or one of your family members needs to be hospitalized, the doctors don't have to second guess. If you're not feeling well or you forgot something, it's all right there. You can fill it out now while you're healthy, while you're in your right mind. And then this information will be so incredibly valuable to the medical team, but also to you. It will help minimize medical errors. It will help minimize some of the miscommunication that can happen in the hospital setting. So again, I think I put the link to that resource. Yes, I did. I put the link to that resource in the description box. All right, so that's really what I wanted to share with you all. You know, I just really want to always make sure that you are educated and empowered so that you can serve as your best advocate, as your loved one's best advocate. And we know that there are many challenges right now in light of the coronavirus pandemic. And being in the hospital is extremely, extremely risky, always, okay? Pre-COVID, after COVID, that is one of the most riskiest, is that right? That is one of the riskiest times where, you know, in terms of your medical care and errors and things like that. So now that you cannot have a family member and advocate at your bedside, even me, I mean, as an independent health advocate, I am not allowed in the hospital. So I am having to, you know, do my work remotely via phone and video chat and all those things. So you need to understand how that's going to potentially impact your health. And the tips that I provided tonight are really to help mitigate some of those challenges associated with the fact that you won't have somebody there to speak for you and to help, you know, fill in those gaps. All right. So let me know if you all have any questions. I hope that this has been helpful to you. I'm going to try to look on my other device to see if you all have any questions. Thank you, Deneen. Deneen said it's a health insurance portability and accountability act. Okay, I think I did say accountability. Excellent. Thank you, Deneen. Hi, Adrian. Hi, Deneen. Hi, Ruby. All right, you guys. So do you have any questions at all? Any comments? Or any of you dealing with this? Have you been hospitalized or have you had family members that have been hospitalized? Have you noticed any unique challenges? Is there anything that I can help you with in this area? If so, go ahead and just drop that in the comments. And if I don't address it live, I will absolutely, as always, come back and address your comments. So I know there's a little bit of a delay, but I don't see any questions right now. So thank you all again for tuning in. Don't forget to download the free guide. I call it your Healthcare Navigator one sheet. You know, a one sheet, we use it in multiple professions. Speakers have a one sheet. Authors often have a one sheet. You know, sometimes there'll be a one sheet for your business where basically the idea is that on one piece of paper, you know, this one is two-sided, all the information that is pertinent to your medical care is there, okay? So make sure that you download that. Please share this video with others so that they can get this useful information. And thanks again for watching tonight's episode of Navigator Nuggets. Again, I'm Dr. Nicole Rochester. I'm a board-certified pediatrician, an independent health advocate, and the CEO of Your GPS Doc. I help family caregivers do 3 things: relieve overwhelm, reclaim their time, and ensure their loved ones receive appropriate and effective health care. I never got to those statistics for you all. I'm sorry, I was not able to pull it up in a readable fashion on my phone. So this episode will not include that. Maybe I'll go back and put it in the comments. But I use the Johns Hopkins coronavirus map as my source for that information. You guys are probably very familiar with that resource as well. All right, so thanks again. I will see you all next Monday at 8:00 p.m. Eastern Standard Time for the next episode of Navigator Nuggets. Please be safe. Please hashtag stay home. I know that some of you are in these states that are talking about opening up on Friday. I don't even have the words to address that right now because I probably would not be able to remain professional. But let me just say, as a medical professional, that's ridiculous. We don't have any information to suggest that now is the right time to open up any individual state or to open up the country. So if you are in states that are relaxing the stay-at-home orders, use common sense, you guys. Use common sense, and also for those of us in states that are still sheltering in place, and I think across the country now they've talked about wearing the facial coverings. I'm not going to call them a mask, but the facial coverings when you go out. I am already seeing that people are getting a false sense of security with that. They are not practicing social distancing. Those cloth masks, are not N95 masks. They are not meant to protect you from coronavirus. And we've talked about this on another episode, so I'm not going to repeat all of that. Do they help at all? Probably yes, but you still must practice social distancing. If you have a cloth covering over your face and you're standing right here talking to somebody and they cough or they sneeze or you cough or you sneeze, you are not protected. So when you're out and about and you're doing only your essential shopping and things of that nature, please continue to stand at least 6 feet away from the next person. Please don't get a false sense of security just because you're wearing gloves, which is a whole nother topic that I'm not going to address tonight, or a facial covering. Okay. I want you all to be safe. I want you to be well. So please, 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 please continue to practice all of the things that we have been told to help flatten the curve and to keep you safe from this virus. And I hope to see you again next Monday at 8 p.m. Eastern Standard Time. Take care.